Hi everyone, it's Miss Lula. Welcome to Cool Chemist, a new video series highlighting the amazing diversity in chemistry, both past and present. Today I'm going to tell you about Alice Ball, a cool chemist you should know. Alice Ball was born on July 24, 1892 in Seattle, Washington. She spent most of her childhood there and went on to study at the University of Washington. She earned a bachelor's degree in pharmaceutical chemistry in 1912 and a second bachelor's degree in the science of pharmacy in 1914. She co-published, along with one of her pharmacy professors, a paper in the Journal of the American Chemical Society. At that time, publishing in a prominent scientific journal was uncommon for women and even more uncommon for Black women. Alice's accomplishments led to scholarship offers from the University of California, Berkeley, as well as the College of Hawaii, which is now known as the University of Hawaii. Alice chose the latter, and in 1915, she became the first woman and the first Black American to earn a master's degree from the College of Hawaii. She continued to trailblaze by becoming a chemistry professor at the university, again being the first woman and the first Black American to do this. Around the turn of the 20th century, leprosy was a major public health concern in Hawaii. Leprosy is an infection caused by a slow-growing bacteria that affects the nerves, skin, eyes, and lining of the nose. If left untreated, the nerve damage can result in crippling of the hands and feet, paralysis, and blindness. At that time, patients who were diagnosed with leprosy were considered to have no chance of recovery. Alice Ball changed this. Ball's master's thesis was about the components of a medicinal plant called the kava root. Because of her understanding of the chemical makeup of plants, she was approached by Harry Holman, a doctor who was treating patients with leprosy. Holman asked Ball to help him determine the active ingredient in chalmugra, a plant that had been used with some small success in the treating of the disease. Holman was looking to isolate something from the plant that was concentrated and injectable. It only took Ball 1 year to fractionate the active oil, allowing her to solubilize it and create an injectable treatment. Unfortunately, Ball suddenly died at the age of 24, possibly due to chlorine poisoning in the lab. Therefore, she did not get a chance to publish her work on the injectable treatment. Arthur Dean, a chemist at the university, took up her work and published the findings. He began producing large quantities of the injectable. He did not give Ball credit and named the technique after himself. The injections were very successful and became the standard of treatment for leprosy until the 1940s, when a more modern treatment replaced it. Several years after her death, Dr. Holman finally attempted to correct the injustice of Dean calling the work his own. Holman published a paper in 1922 giving credit to Ball, calling the injectable form of the oil the Ball method. In 2000, to honor Ball, the Lieutenant Governor of Hawaii named February 29th Alice Ball Day. For her trailblazing accomplishments and her invaluable contribution to the treatment of leprosy, Alice Ball is certainly a cool chemist you should know.